Hey, stay with me for a moment. Are you still there? Okay, now imagine this. Imagine stepping into work knowing that any decision you make could potentially make the difference between life and death over a ton of strangers. Now, imagine doing that every single day. That must be a huge responsibility, right? Well, that's the life of millions of healthcare workers around the globe. Doctors, nurses, medical laboratory scientists, and other allied healthcare professionals dedicate their lives daily to caring for and saving the lives of others, sometimes at the expense of their own health. Research consistently shows that healthcare workers experience significantly higher rates of mental health challenges than other professions. Healthcare workers are constantly exposed to challenging environments and stressful events in workplace that make them prone to poor mental health. Among these include long working hours, irregular shifts, intense physical and mental work, continuous exposure to deaths, and commonly experiencing workplace violence from patients or their relatives, and sometimes even workplace bullying from senior or supervising colleagues. Healthcare workers suffer from a vast range of mental health challenges, among which include anxiety, stress, depression, burnout, and even suicidal thoughts. Epidemiological studies around the world have shown that roughly 26 to 50% of healthcare workers have symptoms of anxiety, and another 23 to 48% have symptoms of depression. During major crises such as COVID-19 pandemic, these numbers have been reported to be even higher, with burnout affecting nearly half of healthcare workers in some studies. So why are healthcare workers so vulnerable? The reasons are numerous, simple, yet complex. I'm going to mention but a few of my personal favorites. First is workload. Continuous understaffing, excessive patient loads, long shifts, excessive night duties, and chronic sleep deprivation gradually wear down not just the body, but the mind as well. Second is emotional burden. Healthcare workers constantly witness pain, trauma, disability, and deaths on a regular basis. Breaking bad news to families, losing patients despite doing everything right, and constantly absorbing other people's suffering can lead to emotional exhaustion and compassion fatigue over time. Third is institutional factors. Poor structure, lack of support, workplace bullying, inadequate resources, unclear or unrealistic job expectations, poor remuneration, and feeling undervalued could all contribute to psychological distress. Then, there are individual factors. Younger professionals, females, frontline workers, those with previous mental health challenges, and individuals with limited social support have been found to be at greater risks of mental health challenges in several systematic reviews. And let's not forget the culture of healthcare itself. Many professionals are taught to be resilient, to keep going, never complain, and always put patients first. Unfortunately, this has created a toxic culture where seeking help is frowned at and seen as being lazy or unfit for the profession. But here's the truth. You cannot pour from an empty cup. Mental health challenges in healthcare workers can compromise service quality, patient satisfaction and safety, diminish hospital productivity and clinical outcomes, and harm the institution's reputation. A burned out healthcare worker is potentially dangerous, more likely to make medical errors, experience reduced job satisfaction, and ultimately provide poorer patient care. Protecting the mental health of healthcare workers isn't just about helping clinicians. It directly improves patient safety and healthcare quality. So, what can we do? Healthcare organizations, the government, and key stakeholders must invest in supportive leadership, access to confidential mental health services, care support programs, and healthier work environments. And as healthcare professionals, we need to normalize asking for help, checking in on colleagues, correcting subordinates with professionalism, compassion, and respect, taking breaks when possible, prioritizing rest, and remembering that caring for ourselves is not selfish. It's part of providing good patient care. I mean, it's literally a component of the Hippocrates Oath. Behind every stethoscope is a human being, and behind every white coat is someone carrying invisible battles. Healthcare workers save lives every day. It's time we protected theirs too.